combination. So that's the way to move forward. I think this is our last question. Do we have any more questions?
No, I'm asking Professor Rabab for a wrap-up of this
This session? All right. Thank you very much.
This combination may be immunotherapy with another immunotherapy, like PGR1 inhibitor together with CTLA4 inhibitor, or combination with chemotherapy. So you can use this or this, but these are only clinical trials.
Yeah, I'm asking you to wrap up because of all these questions to give the audience what is the recommendation of the panel from the testing.
Not for the last one, you mean, right? Not for the last one.
No, not for the last one.
Okay.
Maybe we could have a summary comment from our two chair people.
Summary comment that unfortunately all the testing that we were planning to do as a standard test before doing chemotherapy or immunotherapy are not of value in most of the diseases, as you saw, with the exception, I think, of PGR1 in first line only, which is pembrolizumab. Otherwise, all PGR1 testing and tumor burden testing, all these tests are not mandatory to be done before giving immunotherapy. This is what I see from the panel here, and what is up till now is not present to be standard, but I believe with time it will be like a marker that we should use before immunotherapy, because we are looking all the time to tailor our treatment and to give the proper treatment to the proper patient. So we have to look for biomarkers and to do testing and to do clinical trials in order to find this. Other than the testing, we saw here also from the panel that the treatment may be PGR1 or PG1 inhibitor, and this treatment will depend on several factors, like the status of the patient himself, and for sure whether to give another drug or not to give other drugs like steroid or antibiotic together with this immunotherapy is important. The status of the patient is very important. Other than this, for different diseases, we have the triple negative in breast cancer. We have all the lung cancer groups. We have in the bladder cancer, and we have in the head and neck cancer. All of them for testing did not show any importance, with the exception of the MSI in colorectal carcinoma. This is the only one that they agreed on. Even the triple negative, it was not mandatory. Even to do the tails was not mandatory in triple negative.
Okay.
I wanted to comment on the last question for patients that progress on a PD-1 checkpoint antibody, that at least as far as I know, at the current time, there's no data for benefit from switching from PD-1 to PD-L1 or backwards. At this point, we don't. There's a clinical trial that's ongoing, but we don't have any data yet that adding chemotherapy after progression to a PD-1 checkpoint drug is beneficial. And so far, we don't have data going from a single agent to multiple agent is efficacious. There are numerous clinical trials looking at it, but right now we don't have any actual data to support that.
I'll ask Lisha one question, because we were talking about breast cancer. Are you using immunotherapy for breast cancer outside the clinical trial?
So I personally do not use immunotherapy outside of a clinical trial for any type of breast cancer.
Okay, thank you very much. And thank you for this important panel about immunotherapy. And we are now preparing ourselves for the next session about the prevention, which is very, very important session to prepare ourselves for the consensus about the prevention in the last session. Thank you very much.